Hi, this is Lois Haggard. I manage the Community Health Assessment Program in the New Mexico Department of Health. In this video, I am demonstrating New Mexico's new Indicator-Based Information System for Public Health, or NM-IBIS. IBIS was designed by public health agencies across the U.S. with lots of input from regional health offices and community health councils right here in New Mexico. So this is a New Mexico product that we can take pride in. You can use Chrome, IE, or other browsers, but unless you have a reason to use Internet Explorer version 8 or earlier, you'll really want to update to a newer version of IE. Okay, I'd like to keep this short and sweet, so let's jump right in. The main navigation of this site is through these tabs at the top of the page. So this is the site navigation that takes you to the main sections of IBIS. The first section is Health Topics. The health topics are organized by this model of health status where health factors lead to health outcomes. If we go to the Health Topics page with all the topics on it, you can see we have a lot of topics. And if we go to one, infectious disease, you can see we have this high-level description of infectious diseases. And at the bottom of every topics page, you'll find links to indicator reports and dataset queries where you can get more information on that topic. The next tab is the Health Indicator tab, where you can get information in health indicator reports. I like to just use this alphabetical list to browse the health indicator reports. And let's choose one here, diabetes deaths. Indicator reports are like issue briefs where they give you the main information you need to know about this topic or this health indicator. So there's why is it important, and then a graph and a table. If you want more detailed information, there's an important facts page where you can get other information on diabetes deaths, and look for these evidence-based practices where you can get information on how to improve health status in New Mexico for that health indicator. Each indicator report also has multiple data views. So this was the default data view that we saw before with the graph, with a trend graph by US and New Mexico. And this indicator author, who's a subject matter expert on diabetes in the New Mexico Department of Health, also has several other data views. For instance, this data view by county. Now, one thing about this new version of NM-IBIS is that anytime you view data by geography, in this case counties, you get one of these pretty New Mexico maps called a choropleth map, shaded with different colors depending on the data for diabetes deaths in this case. Okay, going across the top, we can explore communities. New Mexico was one of the main designers of these pages. So here's a page where you can select a community, select a set of health indicators, and get information on a whole bunch of health indicators for a single community, in this case Doña Ana County. Another indicator report, community report, has information for those same health indicators, but in a report that you can page through and get more information on each indicator in the report. Moving across the top, we have Explore Datasets. And let's look at the American Community Survey data. These are census data. And we can look at, for instance, child poverty. And these dataset queries take you to a page called the Query Builder page, where you can select geographies, time periods, and how to display the data. And then you submit the query and you get a data results page. In this case, the page shows a map by small area for children under age 18 living in poverty. Now I want to show you a couple of features of the IBIS maps. One is that If you mouse over an area, you get a data pop-up up in this left-hand corner of the page. If you want that pop-up to persist, you can right-click on the area and select Show Data Pop-up. You can zoom into the map also by right-clicking, Zoom to Fit, and you can look at Bernalillo County, the Albuquerque area, and here's Kirtland Air Force Base, and we can show the data pop-up. You can also zoom in using the zoom tool and the reset default zoom. Other features of the map include labels. You can put county labels up there, region labels, health region boundaries. Now, a lot of people are going to want to export a map into another application like Word or PowerPoint. What I do when I want to do this is I turn off the base map because I think that just makes a little bit cleaner picture of the map, and then I can get the map and the legend kind of where I want them situated. And I use a snipping tool. Now I found this tool so handy that I've got it in my taskbar, but you can get to it by clicking on the Start menu, Programs, Accessories, and Snipping tool. And what it does is it puts this whitish veil over your screen, and then you can select the area of your screen that you want to copy or snip, and it makes a copy of that area and puts it in your copy-paste buffer. Once you've got that in your buffer, you can put that image in another document like Word or PowerPoint, and there it is. The other thing I want to share with you about the maps is that in this Layers Control menu, you can choose different ways to group in this case, small areas in your map. Let me turn off these region names and boundaries. The default is quartiles, but I could choose 3 groups, and then we'd have all 109 small areas in the state grouped into 3 equal-sized groups, with the low percentage areas, the medium percentage areas, and the high percentage areas. Now in this map, the percentage of children in poverty, the higher the percentage, that's a negative thing. The more kids are living in poverty. So we've colored the high percentages with this dark red color. That means warning or alert, attention. But let's say that this map was for prenatal care, where high percentages are good. In that case, I could reverse the colors and show that the high percentage areas are in this light yellow color, whereas the low percentages are in the dark color. So those are most of the features of the maps in a nutshell. If you're a Power GIS user, you can also download the map layers for use in other programs. One other feature of the graphics in IBIS, if I run a query here by, let's do crude death rates for, let's choose unintentional injuries, and we've got counties selected, and let's choose a couple of years, and then we display the data by geographic area, which is county, as we saw just a second ago. I get a data results page. Again, I get a map because we ran the data by geography. But let's say that I want a bar chart. Well, I can choose up here in chart options. I think a horizontal bar chart would work well for counties. And we can see that in addition to the map, I also get a horizontal bar chart. Well, let's say that I want to sort these counties by their death rates instead of by the alphabetical name of the county. To do that, I select in the table the column that I want to sort on, and I click it, and this is sorted from low to high. If I click it again, it's sorted from high to low. And then I scroll back up here to my graph, and I can see that by sorting the table, I've sorted the counties in my graph. And now I can take a snip of this or do whatever I want with that. Okay, so now let's move on to the Resources tab. And just a couple things I want to point out here is the glossary, or one is the glossary. So this is a glossary of public health terms, but it also serves as an index of the IBIS website. So if I go to C, you can see that I have a definition of a choropleth map that we've been looking at. And if I go to S, something that might be interesting is the page on small areas. And you can see that there's a link to a help page. I go to that help page and there's a lot of information on what the small areas are and how they came to be. And then we also have these maps that show a zoomed in view of various communities where it's hard to see on the state map. But here's Santa Fe, and we can see that small area 95 is downtown Santa Fe, and it actually includes the health department where I'm sitting right now. The other thing I wanted to show under resources is this 5 clicks to community health page, and I'm going to use my local host because I have updated the images here. And 5 clicks to community health has these images that take you through 1 click at a time how to get to those community health reports that we saw a minute ago. And you go through 1 click at a time, and guess what? It was really only 4 clicks. So that's it for the IBIS web page. The URL for IBIS is ibis.health.state.nm.us. That's all you need. Put that in your browser and it will take you to the IBIS welcome page, and you can browse the site from there. So happy browsing. Thanks for your time.